First question. Which among the following muscles is a strong abductor and medial rotator of the thigh? A. Gluteus medius, B. Pectineus, C. Gracilis, D. Obturator externus. The answer is A. Gluteus medius. Second, which among the following organ has both skeletal and smooth muscles in its muscularis externa? A. Jejunum, B. Esophagus, C. Stomach, D. Duodenum. The answer is B. Esophagus. Next, the cerebral arterial circle of Willis, composed of all of the listed arteries except A. Basilar artery, B. Internal carotid artery, C. Anterior cerebral, D. Choroidal artery. The answer is D. Choroidal artery. Next, which of the following carpal bone of the hand is found in the proximal row? A. Pisiform, B. Trapezium, C. Capitate, D. Hamartate. The answer is A. Pisiform. Fifth question. Stimulation of the parasympathetic nervous system leads to A. Constriction of pupils, B. Constriction of skin vessels, C. Constriction of gastrointestinal sphincters, D. Constriction of brain vessels. Answer is A. Constriction of pupils. Next, sharply delineated eosinophilic inclusion in the neuronal pericardia and proximal dendrites in the rabies are known as A. Cowdry B bodies, B. Guarneri bodies, C. Negri bodies, D. Cowdry A bodies. Answer is C. Negri bodies. Next, which of the following is a human RNA virus? A. Parvovirus, B. Rhadovirus, B. Papovirus, D. Pox virus. Answer is B. Rhadovirus. Next, which of the following is a high-level disinfectant? A. Glutaraldehyde, B. Quaternary ammonium compound, C. Alcohol, D. iodophores. The answer is A. Glutaraldehyde. Next, which is the recommended transport medium for Vibrio cholerae? A. McConaughey's agar, B. Pike's medium, C. SARS buffered glycerol saline, D. Carey Blair medium. Answer is D. Carey Blair medium. Next, undulant fever is commonly transmitted by all of the following routes except A. Person to person, B. Through the placenta of animals, C. Aerosol transmission, D. Eating uncooked food. And the answer is A. Person to person. Next, group in which individuals interact over a long period of time on a direct and personal basis is known as A. Formal group, B. Large group, C. Primary group, D. Reference group. The answer is C. Primary group. Next, spread of one's cultural practices, beliefs, or items among members of the same culture or different culture around the world is known as A. Cultural transmission, B. Cultural diffusion, C. Cultural inventions, C. Cultural uniformity. Answer B. Cultural diffusion. Next, arrange the stages of family cycle in chronological sequence. Option C is the correct answer. Formation, extension, complete extension, contraction, complete contraction, dissolution. Next, mixing of two cultures due to cultural contract. When people with different cultures comes in contact is known as A. Sociometry, B. Socialization, C. Social mobility, D. Acculturation. Answer option D. Acculturation. Next, which among the following is a formal method of social control? A. Coercion, B. Norms and mores, C. Morality, D. Customs. Answer is option A. Coercion. Next, which of the following is a similarity between thematic appreciation test and word association test? A. Both tests are example of learning approach for studying personality. B. Both tests are example of projective personality test. C. Both tests were evolved from Minnesota multiphasic personality inventory. B. Both tests are evolved from social learning theory. Correct answer is option B. Both tests are example of projective personality test. Next question. When we gather together particular observations in the form of premises and draws a general condition, it is A. Deductive reasoning, B. Inductive reasoning, C. Divergent thinking, D. Critical thinking. Answer is option B. Inductive reasoning. Next question. When an old memory interferes with a new memory, it is known as A. Displacement, B. Retroactive interference, C. Proactive interference, D. Fading. The answer is C. Proactive interference. Next, learning in which behavior is strengthened followed by reinforcement is known as A. Classical conditioning, B. Transfer of learning, C. Latent learning, D. Operant conditioning. The answer is option D. Operant conditioning. Next question. A type of long-term memory that deals with the encoding of abstract knowledge is A. Semantic memory, B. Episodic memory, C. Implicit memory, D. Flashbulb memory. The answer is A. Semantic memory. Next, how many drops per minute are to be administered for 50 ml per hour IV infusion with drop factor 20 ml? A. 20, B. 15, C. 3, D. 5. The answer is option D. 5. Next, what nursing action prevents the transmission of pulmonary tuberculosis? A. Wear a mask when exiting the room. B. Wash the hands after leaving the room. C. Have the client wear a mask from admission. D. Stock the supply cart at each shift. Answer is option C. Have the client wear a mask from admission. Next, what is the compression ventilation ratio in adult basic life support? A. 30 is to 1, B. 30 is to 2, C. 15 is to 1, D. 15 is to 2. The answer is option B. 30 is to 2. Next, what is the GCS score if a patient is opening eyes to cold, localizes pain and confused? A. E3M4V4, B. E3M5V4, C. E4M4V3, D. E4M5V3. Answer option B. E3M5V4. Next question. A life-threatening complication of immobility is A. Pulmonary embolism, B. Pulmonary edema, C. Gastrointestinal bleeding, D. Urinary tract infection. The answer is A. Pulmonary embolism. Next, which cranial nerve is evaluated by asking the patient to smile, frown, and raise and lower the eyebrows? A. Trigeminal, B. Oculomotor, C. Facial, D. Hypoglossal. And the answer is option C. Facial nerve. Next, interpret the ABG values. pH 7.35, PaO2 95%, PaCO2 49%, bicarbonate 30 milliequivalent deciliter. A. Respiratory acidosis compensated, B. Respiratory acidosis partially compensated, C. Metabolic acidosis compensated, D. Metabolic acidosis partially compensated. The answer is option A. Respiratory acidosis compensated. Next, the gradual decrease of body's temperature after death is called A. Livor mortis, B. Algor mortis, C. Rigor mortis, D. Hypomortis. Answer is option B. Algor mortis. Next question. Which of the following indicates proper use of a triangle arm sling? A. The sling extends to the proximal of the hand. B. The elbow is kept flexed at 90 degree or more. C. The sling is removed every 2 hours. D. The knot is placed on either side of the vertebrae of the neck. Answer is option D. The knot is placed on either side of the vertebrae of the neck. Next, what finding on physical examination of a patient is a possible indicator of malnutrition? A. Spoon-shaped nails. B. Nails curve around the fingertips. C. Pinkish red oral mucous membrane. D. Thick dry skin and dry hair. Option D is the correct answer. Thick dry skin and dry hair. Next, the recommended calorie requirement of 2-year-old child is A. 1000 kilocalorie per day, B 1100 kilocalorie per day, C 1200 kilocalorie per day, D 1300 kilocalorie per day. Answer is option B 1100 kilocalorie per day. Next, the rate of energy supply of protein is A 4 kilocalorie per gram, B 7 kilocalorie per gram, C 9 kilocalorie per gram, D 12 kilocalorie per gram. Correct answer is option A 4 kilocalorie per gram. Next question. The vitamin that promotes absorption of iron is A. Vitamin E, B. Vitamin D, C. Vitamin A, D. Vitamin C. Answer is option D. Vitamin C. Next, which among the following is a viral foodborne infection? A. Typhoid fever, B. Salmonellosis, C. Gastroenteritis, D. Amoebiasis. And the answer is option C. Gastroenteritis. Next, which among the following is the method of intervention for secondary prevention? A. Health promotion and specific protection, B. Environmental protection and modifications, C. Disability limitation and rehabilitation, D. Early diagnosis and treatment. Answer is option D. Early diagnosis and treatment. Next, a child can draw a complete rectangle at A. 2 years, B. 3 years, C. 4 years, D. 5 years. Correct answer is option C. 4 years. Next question. The cabinet temperature maintained in ILR is A. plus 2 degrees Celsius to plus 8 degrees Celsius, B. minus 4 degrees Celsius to plus 4 degrees Celsius, C. minus 14 degrees Celsius to minus 20 degrees Celsius, D. plus 8 degrees Celsius to plus 14 degrees Celsius. Correct answer is option A. plus 2 degrees Celsius to plus 8 degrees Celsius. Next, postcoital contraception is recommended within A. 96 hours of an unprotected intercourse, B. 72 hours of an unprotected intercourse, C. 48 hours of an unprotected intercourse, D. 24 hours of an unprotected intercourse. Option B is the correct answer. Next question. The capacity of an infectious agent to invade, survive and multiply in a host is called A. Contamination, B. Pathogenicity, C. Virulence, D. Infectivity. Answer is D. Infectivity. Next, a pneumoconiosis due to inhalation of cotton dust over long period of time is A. Silicosis, B. Bisonosis, C. Bagosis, D. Siderosis. The answer is option B. Bisonosis. Next, chemotherapy drug that is well known to produce cardiac toxicity is A. Doxorubicin, B. Dacarbazine, C. Streptozotocin, D. Ifosfamide. The answer is option A. Doxorubicin. Next, bear hugger is used to A. Oxygenate the patient, B. Fumigate OT, C. Provide warmth, D. Assess arterial blood gases. The correct answer is option C. Provide warmth. Next, patients with rhabdomyolysis are at risk for the developing A. Acute coronary syndrome, B. Acute kidney injury, C. Fulminant hepatic failure, D. Fat embolism syndrome. Correct answer is option B. Acute kidney injury. Next question. Albuterol is A. Bronchodilator, B. Mucolytic, C. Corticosteroid, D. Vasodilator. Correct answer is option A. Bronchodilator. Next question. Drug used to maintain patency of patent ductus arteriosus is A. IV propranolol, B. Injection atropine, C. Injection morphine, D. Prostaglandin infusion. And the answer is option D. Prostaglandin infusion. Next question. Cobblestone appearance is seen in A. Pulmonary fibrosis, B. Subcutaneous emphysema, C. Crohn's disease, D. Ulcerative colitis. Answer is option C. Crohn's disease. Next question. Scleral buckling is done as the management of A. Retinal detachment, B. Strabismus, C. Glaucoma, D. Astigmatism. Answer is option A. Retinal detachment. Next, normal value of HCO3 level in the arterial blood is A. 30 to 34 milliequivalent per liter, B 22 to 26 milliequivalent per liter, C 12 to 20 milliequivalent per liter, D 44 to 50 milliequivalent per liter. Answer is option B 22 to 26 milliequivalent per liter. Next, swagged needles are suture needles. Option A with oblong eyes, B with split eyes, C without eyes, D with spring eyes. Answer is option C without eyes. Next, the NIHSS is a scale that is used to assess A. Outcome of patients with stroke, B. Health status of patients with sepsis, C. Outcome of patients with shock syndrome, D. Health status of patients with spinal surgery. Correct answer option A. Outcome of patients with stroke. Next, the defense mechanism of voluntary blocking of distressing thoughts or feelings from one's awareness is called A. Repression, B. Regression, C. Sublimation, D. Suppression. Answer is option D. Suppression. Next, which of the following are correct about physical barriers of communication? 1. Noise, 2. Hearing deficit, 3. Introvert personality, 4. Lack of privacy. Option A only 1 and 3, option B only 1 and 4, option C only 2 and 3, option D all of the above. Answer B is the correct answer, only 1 and 4. Next question, which is the main source of dopamine from brain? A. Thalamus, B. Cerebrum, C. Substantia nigra, D. Cerebellum. And the answer is option C. Substantia nigra. Next question, exaggerated conception of one's own importance, social power or identity is called A. Delusion of grandeur, B. Delusion of persecution, C. Delusion of reference, D. Delusion of infidelity. And the answer is option A. Delusion of grandeur. Next, the purposeless, stereotyped, involuntary, repetitive jerking movement of short duration due to contraction or twitching of small group of muscles are called A. Tremor, B. Torticollis, C. Tics, D. Mannerisms. Answer is option C. Tics. Next, the imaginary perception in the absence of real stimuli is called A. Illusion, B. Delusion, C. Hallucination, D. Dementia. Correct answer is option C. Hallucination. Next, what is the inability or difficulty in describing one's emotions or unable of being aware of one's emotion or mood? A. Alexithymia, B. Anhedonia, C. Ambivalence, D. Autism. And the answer is option A. Alexithymia. Next question, all drugs are mood stabilizers except A. Lithium, B. Librium, C. Sodium valproate, D. Carbamazepine. Answer is option B. Librium. Next, the behavioral therapy in which the pleasant stimulus is paired with an unpleasant response is A. Flooding, B. Systematic desensitization, C. Aversion therapy, D. Abreaction. Answer is option C. Aversion therapy. Next question, which of the following statements are correct about positive symptoms of schizophrenia? 1. Delusion, 2. Hallucination, 3. Disorganized speech, 4. Anhedonia. Correct answer is option D. All of the above. Next question, the target group of weekly iron and folic acid supplementation program is A. Adults, B. School-going girls and boys, C. Older people, D. Breastfeeding infants. Answer is option B. School-going girls and boys. Next, which of the following does not belong to the major criteria of Jones criteria for diagnosing acute rheumatic fever? A. Carditis, B. Chorea, C. Arthralgia, D. Polyarthritis. Answer is option C. Arthralgia. Next question, the common fracture in neonates during the passage through small maternal pelvis. A. Fracture clavicle, B. Fracture femur, C. Fracture skull, D. Fracture patella. Answer is option A, fracture clavicle. Next, which of the following method is not used to estimate body surface area burned? A. Rule of 9, B. Rule of hand, C. Rule of 10, D. Rule of 5. Answer is option C, Rule of 10. Next, the educable group of mental handicap belong to IQ level of A. 21 to 35, B. 0 to 20, C. 36 to 50, D. 51 to 70. Answer is option D, 51 to 70. Next, levetiracetam drug is commonly used in children for the treatment of A. Nephrotic syndrome, B. Atrial septal defect, C. Seizures, D. Pneumonia. Answer is option C, seizures. Next, ductus arteriosus is a fetal large vessel which connects A. Right pulmonary artery with descending aorta, B. Left pulmonary artery with ascending aorta, C. Right pulmonary artery with arch of aorta, D. Left pulmonary artery with descending aorta. Option D is the correct answer. The ratio of all fetal deaths and early neonatal deaths weighing 1000 gram and above and total live births weighing 1000 gram and above is A. Perinatal mortality rate, B. Neonatal mortality rate, C. Post neonatal mortality rate, D. Infant mortality rate. Answer is option A. Perinatal mortality rate. Next, poor communication skills, repetitive behavior, abnormalities in social interactions are the characteristic manifestations of A. ADHD, B. Autistic spectrum disorders, C. Learning disability, D. Temper tantrum. Answer is option B, autistic spectrum disorder. Next, ugly duckling stage in dentition is associated with A. Infancy age, B. Adolescent age, C. Preschool age, D. School age. And the answer is option D, school age. Next question, the therapeutic level of serum magnesium is A. 0 to 3 milliequivalent per liter, B. 4 to 7 milliequivalent per liter, C. 8 to 10 milliequivalent per liter, D. 10 to 12 milliequivalent per liter. Answer is option B, 4 to 7 milliequivalent per liter. Next, which of the following is true regarding Erb's palsy? A. Injury to first and second cervical nerve roots, B. Arm remains abducted, C. The biceps jerk is lost, D. Hand grasp is abnormal. Answer option C, the biceps jerk is lost. Next, which of the following are hazards of gestational diabetes mellitus? 1. Increased perinatal dose, 2. Macrosomia, 3. Oligohydramnios. Answer is option A, 1 and 2. Increased perinatal loss and macrosomia. Next, which of the following statement is or are correct about withholding resuscitation in newborn? 1. Birth weight less than 400 grams, 2. Gestational age less than 23 weeks, 3. Asystole for less than 10 minutes after effective resuscitation. Answer is option A, 1 and 2. Next, failure of emission of semen is known as A. Asthenozoospermia, B. Azoospermia, C. Aspermia, D. Oligospermia. Answer is option C, aspermia. Next, which of the following can prevent prolonged labor? 1. Antenatal or early intranatal detection, 2. Use of partograph, 3. Avoiding augmentation of labor. Answer is option B, 1 and 2. Next, the positive evidence of pregnancy and living fetus includes A. Jacquemus signs, B. Osiander sign, C. Active fetal movement, D. Fetal heart sound. And the answer is option C, active fetal movement. Next, which of the following are immediate puerperal emergencies? 1. Postpartum hemorrhage, 2. Acute retention of urine, 3. Shock. Answer is option 1 and 3, postpartum hemorrhage and shock. Next, which of the following are the intrapartum risk factors of puerperal sepsis? 1. Antepartum hemorrhage, 2. Dehydration and ketoacidosis, 3. Preterm labor. Answer is option B, only 1 and 2. antepartum hemorrhage and dehydration and ketoacidosis. Next question, which of the following is a fact of endometriosis? A. Asymptomatic in good number of cases. B. Absence of remission in pregnancy. C. Subjective symptoms are proportionate to objective signs. D. Not frequently associated with infertility. Answer is option A. Asymptomatic in good number of cases. Next question, focus of teaching must be A. Teacher-centered, B. Student-centered, C. Institution-centered, D. Society-centered. And the answer is option B. Student-centered. Next, Dash is a teaching method that encourages critical thinking of learners, analyze the situation and apply principles to reach a valid conclusion. A. Micro teaching. B. Programmed instruction. C. Self-instructional module. D. Problem-based learning. Answer is option D. Problem-based learning. Next, one speaker addresses large audience is Dash method of teaching. A. Lecture. B. Symposium. C. Panel discussion. D. Role play. Answer is option A. Lecture. Next question, find the mode of the following distribution. Option A 1, B 3, C 4, D 5. Answer is option B 3. Next, the size of flashcards to address small group of audience is A 10 cm to 15 cm, B 10 cm to 20 cm, C 15 cm to 15 cm, D 25 cm to 30 cm. Answer is option D 25 cm to 30 cm. Next, a quasi-experimental design does not have the feature of A. Manipulation, B. Control, C. Randomization, D. Post-test. Answer is option C. Randomization. Next, a tentative prediction of relationship between two variables is A. Problem statement, B. Objective, C. Hypothesis, D. Standard error. Answer is option C. Hypothesis. Next, Dash is a tool that assigns a numeric score on a continuum with respect to the attribute being measured. A. Structured questionnaire, B. Scale, C. Checklist, D. Q sorts. Answer is option B. Scale. Next, the level of significance represented as P is the probability of making A. Type 1 error, B. Type 2 error, C. Both A and B, D. None of the above. Answer is option A. Type 1 error. Next question, blood pressure value is dash type of data. A. Nominal, B. Ordinal, C. Both A and B, D. Continuous. Answer is option D. Continuous. Next, the means of direction, guidance and controlling workforce to accomplish the assigned task in management process is A. Delegation, B. Supervision, C. Motivation, D. Observation. Answer is option B. Supervision. Next, a diagrammatical representation of the formal organization structure is A. Organogram, B. Gantt chart, C. PERT chart, D. Pie chart. Answer is option A. Organogram. Next, the process of ensuring that events conform to plan in an organization is A. Planning, B. Controlling, C. Organizing, D. Directing. Answer is option B. Controlling. Next, the quantity of stores set apart is used only at the time of emergency for unforeseen demands is called A. Buffer stock, B. Cycle stock, C. Optimal stock, D. Available stock. Answer is option A. Buffer stock. Next, an organization that defines hierarchical relationships, authority and responsibilities is A. Functional organization, B. Formal organization, C. Line organization, D. Informal organization. Answer is option B. Formal organization. Next, which one of the following is a necessary process that requires healthcare institutions to meet minimum standards to operate? A. Accreditation, B. Affiliation, C. Licensure, D. Certification. Answer is option C. Licensure. Next, the style in which management does not allow subordinates to participate in decision making due to low confidence in them is known as A. Exploitative, B. Authoritative, C. Consultative, D. Participative. Answer is option A. Exploitative. Next, PostGorb, a 7-activity acronym coined by one of the following experts in management is A. Linda Urwick, B. McGregor, C. Locke, Edwin A. D. Luther Gulick. Answer is option D. Luther Gulick. Next, the principle of ethics, that means tells the truth, be honest with the patients, families and peers, is A. Fidelity, B. Non-maleficence, C. Veracity, D. Beneficence. Answer is option C. Veracity. Last question. A process of moving or allocating the human resources to new workstation within the organization structure is A. Deployment, B. Development, C. Appraisal, D. Allocation. Answer is option A. Deployment.